Today we are going to discuss regarding this particular drug SGLT2 inhibitor. In that, a particular drug Dapagliflozin. In that group, other drugs are also there: empagliflozin, canagliflozin, for that matter, any glyphosine. The SGLT2 inhibitor commonly encountered clinical side effects. What we handle? The first and foremost, urinary tract infection. As you know the mechanism, it blocks the glucose sodium cotransporter, because of which the glucose in the urine increases. It makes the patient susceptible to infection. So patients on glyphosine, yes, they are at bit higher risk of urinary tract infection. More than 3 episodes of recurrent UTI, preferably this drug have to be stopped. First one. Coming to the second one, euglycemic ketoacidosis. A medicine resident who is listening, I hope you know euglycemic ketoacidosis. For those who doesn't know, it is nothing but even at a lower level, comparatively lower level of glucose, acidosis, diabetic ketoacidosis can happen. Because as a first year or the beginner who are in the medical department or medicine residency, they always might have thought diabetic ketoacidosis means sugar should be more than 350, 400, 500 for that matter. But those who are taking these drugs, even at a lower values, 250 or 300 or below, even they develop ketoacidosis. That is called euglycemic ketoacidosis. Second, this one. This is not so common but can occur. In a tertiary care center, it is not uncommon to encounter this situation. 2 is done. Third one, rise in the creatinine. 30% is expected. Above 30%, you have to see for the cause of rise in creatinine, and you might have to stop the drug if there is no other cause. So when to do the creatinine level after starting dapagliflozin? Suppose a new patient is being started on this glyphosins. First, before starting, you might have to wait for 2 weeks, 4 weeks. As my practice, I always do it after the second week and check for the creatinine. In some particular patient, after 5 days. In some particular patient, serially also. Preferably and theoretically, after 4 weeks, check for creatinine. If there is 30% rise, check for other causes. If no other causes, better to stop this drug. This third one is done. Any other side effects apart from this? Yes, fourth one is there, dehydration. Since it is having a diuretic effect, it is blocking sodium glucose cotransporter. Both sodium and glucose will be released into the urine, having the diuretic effect. So what will happen? It will cause a mild degree of dehydration. So dehydration will occur if a patient is not taking adequate hydration. Dehydration itself is a problem. It might lead to pre-renal nephrology territory acute kidney injury. Yes, pre-renal AKI is common if patient is not adequately hydrated, especially in old age. Fourth, these are the 4 particular specific things related to this group of drugs. Apart from that, other complication, as you all know, any GI problem that you can add it up. So 4 particular problem related to SGLT2 inhibitor, you should be aware of all these, so that you can make the diagnosis at a early stage, or if required, you can stop the drug. Bye bye.